Hi everyone. This video we will talk about Sonosite x-porte. It comes with a 19-inch LED display monitor, and a large 12.1-inch touchscreen control panel can be articulated to make its uses easier. And on the right side of the console, there are ports for USB devices. These can be used for storage and transfer of images, or for system software upgrades. To adjust the machine height, press on the foot pedal located on the bottom, which will allow you to move the machine downwards or upwards to a comfortable height. To turn the console on, press the power key once. When the machine turns on, the 4 options will appear on the startup working screen. The first option is for scanning immediately, but the last type of exam will be defaulted. The second one is for entering patient data. It is recommended to enter the first and last name of your patient with their date of birth and their HC number. Also enter some relative indications to remind you later about the exam. Note that all the information that you enter will be auto-populated on the display. The third option is for choosing the transducer and selecting the particular exam. And it will give you the active different transducers that are connected to the machine. And underneath each transducer, you will find different types of exams that later will be reflected on the screen. The last option is for learning and provide educational material. It provides with 3D animation tutorials built in, that can help with training and recalling proper techniques, terminology, and more. Also, you can run a video plays while scanning is active, so you can practice scanning techniques in conjunction with the visual guides. On the top of the touch control panel display, some menus will appear. First one is for entering patient data. Second one is for choosing the desired transducers and preferable exam. The third one is for reviewing the images that already captured. To optimize your scan, you have to adjust depth and gain. First, to adjust depth, you can move the blue scroll marker on the scroll bar that in the right side of the touch screen for adjustment of imaging depth. Moving up decreases imaging depth. And moving down increases imaging depth. For manual gain, hit the gain button, and it will show 3 controls for gain compensation. Near gain is to adjust the gain applied to the near field of the image. And far gain is for adjusting the gain applied to the far field of the image. You can also customize the auto gain level by using the auto gain button instead of using the manual gain controls. To perform zoom in to magnify the image 2 times. The modes menu are shown in the left side of the control panel display are the basic mode, the 2-dimension mode or 2D, C mode or color mode, Doppler or D mode, motion mode that present here as a M mode. To freeze an image, simply hit freeze to make it activate. Also, some controls appear when the image is frozen. Distance, to measure the distance between 2 points. These measurements will appear on the both of left side of the control panel and the display screen. Slide to unfreeze to go back to the home screen, or double tap with 2 fingers on the screen. To record a video or a short clip, simply hit the Save Video Clip button. To save the image as picture, press on Save Image that located on the bottom left of the screen. To recall previous captures, select Review from the top of the screen. In the More control option, target depth, to measure the distance from the skin line to a specified point on the image. A needle profiling package comes in the Sonosite x-porte to allow you to a steep, medium, or shallow insertion. To connect the transducer, look underneath the machine. Insert the transducer connector, turn the latch counterclockwise and press the latch down to lock the latch. To remove the transducer, pull the latch up and rotate it clockwise. Pull the transducer connector away from the system. In terms of cleaning and disinfection, the recommendation from the machine manufacturer is that everything will be cleaned down and wiped up with flannel or clinol wipes that do not contain alcohol to prevent damage to the transducers, cables, and the machine itself.